Most diabetics focus on cutting carbs, taking meds, and tracking blood sugar. But there's one major thing they overlook: minerals. These nutrients keep insulin working, protect nerves, and prevent complications. The problem? Most diabetics are low on key minerals that affect their diabetes health. And if you're missing them, managing diabetes gets a lot harder. Today, we're breaking down the top 3 minerals every diabetic needs. If you're always tired, dealing with body pain, or struggling to control blood sugar, this video can be a real help for you. Stick around because I'll also share the best foods and supplements to make sure you're getting enough. Let's get into it. 1. Magnesium. Magnesium is one of those minerals you don't think about until it starts running low. And for diabetics, that happens more often than you'd expect. Every time your blood sugar is high, your kidneys work overtime to flush it out. But in the process, they also get rid of a lot of magnesium. Over time, this constant loss leaves you depleted, making it harder to keep blood sugar stable. And here's where things get worse. Low magnesium makes your body more insulin resistant. That means blood sugar stays high, which causes even more magnesium loss. It's a vicious cycle, and most people don't even realize it's happening. The tricky part is that magnesium deficiency looks a lot like everyday problems, and it's easy to miss. Muscle cramps and twitching, especially in the legs and feet, are common because magnesium helps muscles relax. If you feel exhausted all the time, even after sleeping well, that's another clue. Magnesium is key for producing ATP, the energy your cells rely on. Nerve issues like tingling, numbness, or burning sensations can get worse with low magnesium. If you've been feeling anxious or struggling to sleep, magnesium might be the missing link. It helps calm the nervous system, so when levels drop, stress hormones take over. Even irregular heartbeats or palpitations can be a sign, since magnesium helps heart muscle contractions. Low magnesium doesn't just cause annoying symptoms, it damages multiple systems in your body. Fertility takes a hit in both men and women. In men, low magnesium reduces testosterone and weakens sperm, making conception harder. In women, it throws off menstrual cycles and raises pregnancy risks. Libido also drops because magnesium helps regulate hormones and blood flow. The nervous system is one of the hardest hit. Without enough magnesium, nerve pain worsens, sensitivity increases, and nerve repair slows down. Your kidneys also suffer because magnesium prevents calcium buildup, and low levels make kidney stones more likely. Eye health declines because magnesium keeps blood vessels flexible. When it's low, oxidative stress rises, increasing the risk of diabetic retinopathy. The heart and blood vessels take the biggest hit. Magnesium keeps blood pressure in check, prevents artery stiffness, and reduces inflammation. Without it, blood vessels may tighten, blood pressure spikes, and the risk of heart attacks and strokes goes up. At the cellular level, magnesium is what helps insulin do its job. It helps activate insulin receptors so glucose can actually enter your cells. When magnesium is low, your cells don't respond to insulin as they should. Magnesium helps produce ATP, the fuel that powers your cells, but low magnesium leaves you feeling drained. Magnesium keeps calcium in check inside cells, but when it's low, calcium builds up where it shouldn't, causing muscle stiffness, inflammation, and oxidative damage. The good news? You can fix magnesium deficiency with the right foods. Pumpkin seeds are one of the best sources. Just 1 ounce, 28 grams, gives you 40% of what you need daily. Cooked spinach is another powerhouse, with 1 cup providing about 38%. Almonds make a great snack, giving around 27% per ounce. Dark chocolate isn't just a guilty pleasure. It's actually rich in magnesium, with a 1 ounce serving providing 24%. Avocados are another easy way to get more magnesium, giving you about 15% of your daily needs per medium-sized fruit. These foods don't just help with magnesium, they also support blood sugar control and overall health. If you want something more gourmet, there are plenty of high magnesium dishes that fit the bill. A Japanese miso-glazed salmon with sesame spinach delivers over 60% of your daily magnesium needs while loading you up on omega-3s for heart health. A French almond-crusted halibut with sautéed Swiss chard provides around 50% of your daily magnesium requirements and supports insulin function. And if you're craving something indulgent, A black truffle and dark chocolate mousse gives you over 40% of daily magnesium needs while satisfying your sweet tooth. For those who need an extra boost, supplements can help, but not all of them absorb well. Magnesium glycinate is one of the best options because it's easy to absorb and doesn't cause stomach issues. Thorn magnesium bisglycinate provides 200 milligrams per capsule and is great for nerve function and muscle relaxation. Another solid choice is Doctor's Best High Absorption Magnesium, which also gives 200 milligrams per tablet in a chelated form for better uptake. These are far better than magnesium oxide, which barely absorbs and can cause digestive problems. But here's the thing, you also need to avoid foods and habits that drain magnesium. White bread, pasta, and processed grains have been stripped of magnesium, so they don't help at all. Too much sugar makes the body lose even more magnesium because insulin spikes cause the kidneys to flush it out. Caffeine, especially from energy drinks and sodas, blocks magnesium absorption. Alcohol is another big problem. It depletes magnesium and interferes with how your body uses it. Even excessive calcium intake, especially from supplements, competes with magnesium for absorption, making deficiency worse. So, if you've been feeling drained, struggling with muscle cramps, noticing more nerve pain, or dealing with blood sugar swings, fixing a deficiency of magnesium could be the missing piece. 2. Zinc. Zinc is one of those minerals most people ignore, but for diabetics, it's a game changer. The problem? Diabetes makes you lose zinc way faster than normal. High blood sugar increases urination, and every time you pee, more zinc gets flushed out. Your pancreas actually needs zinc to release insulin properly. Without it, insulin function slows down, making blood sugar harder to control. Chronic inflammation, which is common in diabetics, also drains zinc levels because your body uses more of it to repair oxidative stress. Certain medications like diuretics and ACE inhibitors can also lower zinc, making deficiency even more likely. The tricky part is that zinc deficiency doesn't always have clear signs. One of the biggest clues is slow wound healing. If small cuts take forever to heal, low zinc could be the reason. Getting sick often is another red flag. Zinc is crucial for immunity, so if you catch colds easily, you may be running low. Intense sugar cravings, that's another clue since zinc helps regulate insulin and appetite. Skin problems like dryness, acne, or stubborn rashes can also point to a deficiency because zinc supports collagen production and skin repair. Other signs include a loss of taste and smell, white spots on your nails, or even hair thinning. Zinc affects almost every major system in your body, so when levels drop, things start going wrong. Fertility takes a hit because zinc is needed for hormone balance. In men, low levels lead to reduced testosterone, lower sperm count, and sluggish sperm movement, making conception harder. In women, it can cause irregular cycles and hormone imbalances that make pregnancy more difficult. Libido drops in both men and women because zinc is tied to testosterone, which fuels sexual desire and energy. The nervous system struggles too. Zinc protects nerves, and without enough of it, diabetic neuropathy can get worse, causing more tingling, burning, and pain. The kidneys also suffer since zinc helps control inflammation, and without it, the risk of kidney disease rises. Vision problems can also worsen, as zinc is critical for retinal health. Low levels can make diabetic retinopathy more severe, leading to vision loss. The heart and blood vessels are another major concern. Zinc keeps inflammation down, prevents artery stiffness, and helps regulate cholesterol. Without it, heart disease, high blood pressure, and strokes become more likely. On a cellular level, zinc is essential for insulin function. It helps insulin bind to receptors so glucose can move from the bloodstream into cells for energy. When zinc is low, insulin doesn't work as well, leading to higher blood sugar and worse insulin resistance. The pancreas also needs zinc to store and release insulin. A deficiency slows this process down, making blood sugar control even harder. Beyond that, zinc is a powerful antioxidant that fights inflammation and oxidative stress. Without it, cells become more damaged, age faster, and function poorly, making diabetes complications even worse. The best way to increase zinc is through food. Oysters are the top source. Just 3 medium oysters give you over 200% of your daily zinc needs. Beef liver is another powerhouse, with 100 grams providing about 80% of what you need in a day. If you prefer plant-based sources, pumpkin seeds are a great choice, with 1 ounce, 28 grams, supplying 50% of your daily zinc. Grass-fed beef is another solid option, giving about 40% per 100 gram serving. Chickpeas, while lower, still offer around 25% per cup, cooked, making them a good choice for vegetarians. If you enjoy gourmet meals, there are plenty of ways to get more zinc while eating well. Japanese oyster sashimi with ponzu sauce, 100 grams, delivers over 200% of daily zinc needs, making it one of the most zinc-rich meals out there. French beef tartare with a quail egg yolk, 150 grams, provides about 90%, while also delivering a high dose of bioavailable iron. A Mediterranean-inspired dish like grilled lamb chops with a toasted pumpkin seed crust, 180 grams lamb, 1/4 cup pumpkin seeds, supplies 80% of daily zinc needs, along with essential minerals that support insulin function and hormone balance. If food isn't enough, high-quality supplements can help. Zinc picolinate and zinc bisglycinate are the best forms since they absorb well. Thorne Research zinc picolinate, 30 milligrams per capsule, is a great option because it's easy on digestion. Another solid choice is Now Foods zinc glycinate, 30 milligrams per tablet, which is chelated for better absorption. Most diabetics do well with 15 to 30 milligrams per day, but since zinc competes with copper for absorption, long-term intake should be balanced. Some foods and habits actually make zinc deficiency worse. High-sugar diets are a major culprit because they increase insulin demand, which leads to higher zinc loss through urine. Whole grains and legumes contain phytates, which can block zinc absorption, but soaking or sprouting them helps. Too much calcium, especially from dairy or supplements, interferes with zinc uptake. Alcohol is another big problem. It depletes zinc and increases inflammation, making insulin resistance worse. Junk food is another issue since processed foods lack nutrients and cause inflammation, further draining zinc levels. Zinc is one of the most underrated minerals for diabetics, but it's essential. Without it, insulin function weakens, blood sugar control becomes harder, and diabetes complications develop faster. Boosting zinc through food or supplements can improve insulin sensitivity, protect nerves, support the heart, and even enhance fertility and libido. This will help with wound healing, lower sugar cravings, and improve immunity. 3. Chromium. Chromium is one of those minerals no one talks about, but if you have diabetes, it matters more than you think. Your body naturally loses chromium through urine. The more sugar in your blood, the harder your kidneys work to flush it out, taking chromium with it more like magnesium. This is a problem because chromium helps insulin move sugar into your cells. Without it, insulin doesn't work as well. To make things worse, stress, processed carbs, and frequent urination drain chromium even faster. Since your body doesn't store much of it, you need to get enough through food or supplements. The tricky part is that chromium deficiency often looks like regular diabetes problems, so most people don't realize they're low. If your blood sugar has been harder to control, even though your routine hasn't changed, low chromium could be the reason. As chromium helps regulate insulin and appetite, so when levels drop, your body struggles to manage sugar cravings and hunger. Feeling tired, mentally foggy, or sluggish, that's another sign. Some people even experience mood swings or anxiety because chromium helps with brain function. If the deficiency gets worse, you might start feeling tingling or burning in your hands and feet. Low chromium affects more than just blood sugar. In men, it can lower testosterone and sperm quality, making conception harder. In women, it can cause irregular cycles and hormonal imbalances, making pregnancy more difficult. It's also needed for circulation and energy, so low levels can reduce sex drive. Your nerves take a hit too. Without enough chromium, blood sugar swings more wildly, which puts extra stress on nerves and increases the risk of nerve damage. The kidneys also struggle. Chromium protects them from oxidative stress, and without it, kidney damage from high blood sugar happens faster. Your vision can suffer too, as low chromium has been linked to worsening diabetic retinopathy. And then there's your heart. Chromium helps control cholesterol and fat metabolism. When levels drop, bad cholesterol rises, arteries stiffen, and the risk of heart disease goes up. At the cellular level, chromium acts like insulin's helper. It's part of the glucose tolerance factor, which makes insulin work better at moving sugar into cells. When chromium is low, insulin becomes weaker, so blood sugar stays high, forcing your pancreas to make even more insulin. Over time, this leads to worse insulin resistance. Chromium also helps break down carbs and fats, so when it's missing, your body struggles to use glucose efficiently. That leaves you tired and more prone to weight gain. The good news? You can boost chromium naturally with the right foods. Broccoli is one of the best sources. Just half cup gives you 50% of your daily needs. Grape juice is high in chromium too, with 1 cup providing about 40%. But since it's sugary, diabetics should drink it in small amounts. Brazil nuts are another great option. Just 1 nut gives you about 30% of your daily chromium needs. Lean beef is also a solid choice, with 3 ounces providing 25%. Eggs contain some too, with each large egg offering about 10 to 15%. If you like gourmet meals, some high-end dishes pack a good dose of chromium. A Japanese Wagyu steak with sautéed broccoli and Brazil nut pesto delivers over 75% of your daily chromium needs, while also providing healthy fats and protein to stabilize blood sugar. A Mediterranean-style grilled lamb chop with rosemary-infused grape reduction and steamed asparagus gives you about 60% of your daily chromium intake and supports heart health. If you want something rich, a French-style duck liver pâté with poached eggs and truffle-roasted mushrooms delivers close to 50% of your daily chromium needs, while also supporting insulin function. If food isn't enough, supplements can help. The best forms are chromium picolinate and chromium polynicotinate because they absorb well and improve insulin function. A good option is Now Foods chromium picolinate, which provides 200 micrograms per capsule, enough to support blood sugar without overdoing it. Another strong choice is Thorne Research chromium picolinate, which offers 500 micrograms per capsule for those with more severe deficiencies. Since chromium is needed in small amounts, start with 200 to 500 micrograms per day and monitor how your blood sugar responds. Some foods and habits make chromium levels drop faster, so avoiding them is just as important. Diets high in refined sugar and processed carbs are the worst offenders because they increase insulin demand, leading to more chromium loss through urine. Too much dairy can also block chromium absorption because calcium competes with it in the body. Processed foods like white bread, pastries, and sugary drinks not only deplete chromium, but also make insulin resistance worse. Alcohol is another major problem. It speeds up chromium loss and makes it harder for your body to maintain stable levels. Chromium may not be the first thing that comes to mind when managing diabetes, but it plays a huge role in keeping blood sugar stable, improving insulin sensitivity, and supporting metabolism. If your sugar cravings are intense, your blood sugar feels out of control, or your energy is always low, boosting chromium could make a real difference. If you found this video helpful, hit the like button and drop a comment below. Let me know which of these minerals you think you need to focus on more. And if you're serious about taking control of your health, don't forget to subscribe because we've got more game-changing tips on diabetes management coming your way. Thanks for watching, and I'll see you in the next one. Take care and stay healthy.